Competency number 4.2. Elicit, document and present a correct history. Demonstrate and describe the clinical features. Choose investigation and describe the principles of management of diseases of external ear. External ear consists of two parts, pinna and external acoustic meatus, and the tympanic membrane, it separates external ear from the middle ear. Diseases of pinna. Pinna may be afflicted by congenital, traumatic, inflammatory or neoplastic syndromes. Congenital disorders: enotia, which is complete absence of pinna. Microtia, the anomalies are associated with external auditory canal, middle ear or inner ear. It can be unilateral or bilateral and hearing loss is frequent. Macrotia, it is excessively large pinna. Bat ear is protruding ear. The concha is abnormally large. It can be corrected surgically after 6 years of age. Cup ear, it is the hypoplasia of the upper third part of the auricle and upper part of pinna is cupped. Cryptopia is the upper part of the auricle is embedded under the scalp skin. It can be corrected by mobilizing the pinna to a normal position and covering the raw area by scalp skin. Coloboma is a transverse cleft in the middle part of the pinna. Preauricular tags, it is also called as preauricular appendages. The skin covers tags that appear on line drawn from tragus to angle of mouth. And preauricular sinus, it is due to incomplete fusion of tubercles. It is seen at the root of the helix. Trauma to the auricle. First is hematoma of the auricle, which is collection of blood between auricle cartilage and its perichondrium. Treatment is by aspiration of the hematoma and packing all the concavities. Lacerations, this should be repaired as early as possible. Perichondrium is stitched with absorbable sutures and broad spectrum antibiotics are given for 1 week. Avulsions, pinna is still attached to the head by a small pedicle of the skin after the trauma. Treatment is by primary reattachment and completely avulsed pinna can be reimplanted by microvascular techniques. Frostbite. It is due to injury due to frostbite. The symptoms are edema, bulla formation and necrosis of skin. Treatment is by rewarming of the pinna, application of 0.5% silver nitrate soaks for superficial infection, analgesics for pain, systemic antibiotics for deep infection. Keloid of the auricle, it is followed by the trauma or piercing of the skin, and common sites are lobules or helix. Inflammatory disorders. First is perichondritis. It is the inflammation of the perichondrium with pus. The symptoms are, it is red, hot, and the pinna is painful and it feels stiff. Treatment is by giving systemic antibiotics and application of 4% aluminium acetate and draining of abscess. Relapsing polychondritis. It is a rare autoimmune disorder involving cartilage of the ear. Treatment is by giving high dose of the systemic steroids. Chondrodermatitis nodularis chronic helicis. It is painful, tender nodules appear near the free border of the helix. Treatment is by excision of the nodule with its skin and cartilage. Diseases of external auditory canal. Congenital disorders. First is atresia of the external canal. The outer meatus is obliterated with fibrous tissue or bone. It may occur in association with microtia. Collateral fistula. In this condition, the fistula has 2 openings. Trauma to the ear canal. It can be minor or major lacerations. Minor lacerations are like Q-tip injury which heal without sequelae, and major lacerations like gunshot wounds, accidents or fights which require careful treatment. Inflammation of the ear canal is by bacterial or fungal or virus. In bacterial, it includes localized otitis externa, which is also called as furuncle, diffused otitis externa, malignant otitis externa. Fungal includes otomycosis and virus includes herpes zoster oticus, otitis externa hemorrhagica. Furuncle. It is a staphylococcus infection of the hair follicle which is seen only in part of meatus. The symptoms are it is painful and tender, and the pain is especially during the movement. Treatment is by giving systemic antibiotics, analgesics, ear pack of 10% ictamol glycerin to reduce pain. In case of abscess formation, incision and drainage should be done. Diffused otitis externa. It is a diffuse inflammation of meatal skin which might spread to involve pinna and eardrum. Two factors are responsible for this, which is trauma to the skin or organisms like Staphylococcus aureus. It has two phases, acute phase and chronic phase. Treatment for acute phase is by thorough cleaning, medicated wicks, antibiotics and analgesics. For chronic phase, it is also a thorough cleaning and a gauze wick soaked in 10% ictamol glycerin. Malignant otitis externa. It is an inflammatory pseudomonas infection. It involves facial nerve. It is common in elderly diabetic patients and it causes pain and granulation in inner canal. Treatment is control of the diabetes, antibiotic treatment against causative organism, surgical debridement of tissue and devitalized bone. Otomycosis, it's a fungal infection of ear canal due to Aspergillus niger, Candida albicans and Aspergillus fumigatus. The features are it causes itching, pain, and there's watery discharge with musty odor. Treatment is by thorough cleaning, by giving antifungal agents like nystatin, clotrimazole and 2% salicylic acid, and ear must be kept dry. Herpes zoster oticus. It is a formation of vesicles on the tympanic membrane, meatal skill, concha and post-auricular groove. It involves 7th and 8th cranial nerves, and treatment is by giving antiviral drugs like acyclovir. Otitis externa hemorrhagica, which is a formation of hemorrhagic bullae on the tympanic membrane and deep meatus. Symptoms are it causes severe pain in ear, blood-stained discharge when the bulla ruptures. Treatment is by giving analgesics which relieve the pain, antibiotics for secondary infection if the bulla has ruptured into the middle ear. Miscellaneous condition. Impacted wax or cerumen. Wax is generally composed of secretions of sebaceous glands, ceruminous glands, hair, epithelial debris, keratin and dirt. The functions of wax is it lubricates the ear, it traps dust and foreign bodies, it is bacteriostatic and fungistatic. Normally small amount of wax is secreted, but in few conditions like narrow ear canal, varying actions of glands, these results to excessive formation of wax. So the patients usually present with impairment of hearing and sense of blocked ear. Treatment is by removal of wax by syringic or instrumental manipulation, and if the wax is hard, it requires prior softening by 5% sodium bicarbonate. Foreign bodies in ear, it can be living or non-living. Non-living like grain seeds, slate pencils or pebbles. Living like mosquitoes, beetles. These might enter ear canal and cause irritation and pain. Methods of removal is by forceps, syringing, suction, microscopic removal with special instruments. Keratosis obturans, it is collection of pearly white mass of desquamated epithelial cells in deep meatus. It causes absorption of bone leading to widening of meatus so much that it might cause facial nerve paralysis. The symptoms are pain in the ear, hearing loss, tinnitus and ear discharge. Treatment is by keratotic mass is removed by syringing or instrumentation. Acquired atresia and stenosis of meatus. It can result from infection, trauma or burns, and treatment is by meatoplasty. Diseases of tympanic membrane. Diseases of tympanic membrane may be primary or secondary to the conditions affecting external ear, middle ear or eustachian tube. Normally, tympanic membrane is shiny, pearly grey with concavity on its lateral surface. This is a picture of normal tympanic membrane. The diseases of tympanic membrane includes retracted tympanic membrane. It appears dull and lusterless. Cone of light is absent. The handle of malleus appears foreshortened and the lateral part of the malleus is more prominent. This is due to negative intratympanic pressure. Myringitis bullosa, it is formation of the hemorrhagic blebs on tympanic membrane and deep meatus. It probably caused by virus or Mycoplasma pneumoniae. Herpes zoster oticus, the viral infection involving geniculate ganglion of facial nerve. There are vesicles on tympanic membrane, deep meatus and concha. Myringitis granulosa, it is a non-specific granulation which is formed on the outer surface of the tympanic membrane. It is associated with the impacted wax, long-standing foreign body. Traumatic rupture, it might get the tympanic membrane might get ruptured due to trauma by objects, sudden change in air pressure or fracture of temporal bone. Treatment is by the edges of perforation should be repositioned and splinted. Tympanosclerosis, it is hyalinization and lateral calcification of tympanic membrane. The tympanic membrane appears as chalky white plaque and is asymptomatic. Thank you.